Hello everyone, I'm Dr. Rajkar and today I'm going to talk about how COVID-19 stress affects teeth grinding and what is it that you can do about it. Are your teeth touching even as you watch this video? If so, that's a sure sign that you're doing some damage. Ideally, your teeth shouldn't touch at all throughout the course of the day, unless you're actively eating, chewing or swallowing. Instead, your jaw should be relaxed with a bit of space between your teeth when the lips are closed. Teeth grinding occurs when the jaws clench together. This unconscious and repetitive clenching of the jaws affects about 10 to 20% of the population and causes logical wear of the teeth surfaces as well as small injuries to the mouth. It's usually caused because of anxiety or stress, and in some cases even due to other health issues or lifestyle factors. This is not a dental problem, but one with clear dental consequences. COVID-19, without question, has changed our lives in a million ways. It impacts us from every angle possible, whether it be social, financial, political or professional. Coronavirus itself does not cause clenching or grinding of teeth. However, it's no secret that pandemic-related stress is affecting our collective mental health. People are uncertain about their jobs. They are staying 24 hours a day at home with their families, putting relationships to test. Parents are extremely concerned about their children's education. With social circles, gyms and religious institutions limited, people don't have the usual outlets. It's easy to see how stressful and difficult things have become. With these increased levels comes the unavoidable clenching and grinding of teeth. All over the world, more and more people are working from homes, often setting up makeshift workstations wherever they find space, on the couch, at the corner of the kitchen counter, or even perched on a bar stool. This results in awkward body positions. It can lead us to hunch our shoulders forward, curving the spine into somewhat close to a C shape. And why this is important is because poor posture during the day can translate into grinding problem at night. A majority of us aren't getting the good night's sleep that we need. Insomnia and restlessness are indicative of an overactive sympathetic nervous system that drives the body's flight or fight response. Imagine a soldier preparing for battle, balling his fists and clenching his jaws. Instead of resting and recharging, COVID-19 related stress keeps the body in a battle-ready state of arousal. Ultimately, all this tension goes straight to your jaws and subsequently to your teeth. People don't always know that they're suffering from teeth grinding, which is also known as bruxism, as it often presents itself overnight. Sleep grinding affects approximately 8 to 15% of the population, and sometimes the teeth grinding is so loud that it can disturb the sleep of others in the same room. If you wake up with the sides of your face, teeth or jaws feeling sore, it's a good indicator that you might be grinding or gnashing your teeth during the night. Most common signs observed from teeth clenching are wearing of teeth, broken teeth, leakage and loss of fillings, face and joint pain, difficulty or pain when opening and closing the mouth, mobility, which is movement of teeth, wounds in the cheek mucosa, teeth sensitivity. Some people even notice more discomfort with normal activities like routine chewing because their muscles have undergone more exercise by clenching and grinding. So what can we do? Well, awareness is the key. If we are aware, then we can bring it into consciousness. The ability to recognize how your body reacts to the stresses in your life is a powerful skill. Most people are more aware of their time, their bank balance, and even the weather than they are of the tensions in their bodies or even their personal stress response. Your body registers stress long before your conscious mind does. Muscle tension is your body's way of letting you know that you are stressed, and body awareness is the first step in acknowledging and reducing that stress. Be mindful and try to stop yourself from grinding when you catch yourself doing so. Putting your sensitive tongue between your teeth while they're resting is one way of sending a feedback to your mind that ensures that you're not grinding. So now moving on to night guards or retainers. These are devices that keep the teeth in proper alignment and prevent teeth grinding. If you have a night guard or retainer, you could use it during the day as well. Instead of teeth grinding together and wearing themselves down, there's a soft or dry splint that acts as a barrier by absorbing and dispensing pressure. And if you ask me, it's better to crack a night guard than to crack a tooth. With no vaccine in the immediate future, we will need to continue to adjust our routines as necessary. For those who will continue to work from home for the next few months, it's important to set up a proper workstation. Ideally, when seated, your shoulders should be over your hips and your ears should be over your shoulders. Computer screens should be at eye level. If you don't have an adjustable chair or desk, then prop your laptops or monitors on a makeshift box or a stack of books. Incorporate exercise in a typical 9 hours a day work shift with some standing whenever possible. Try to utilize each and every phone call or washroom break as an opportunity to take more steps. Exercise, in addition to benefiting our physical state, also helps to relax the mind. If you suffer from anxiety, avoid over-information, especially at the last minute of the day. Try to maintain a fixed schedule and the usual routine, especially related to sleeping hours. At the end of the day, try to do some yoga or stretching exercises, as these will help to relax and relieve the pressure and tension from your body. Customized pillows and neck positioners help to relieve the pressure and stress from your jaws and neck while sleeping. Meditation not only helps to relax the mind, but it can also trigger the body's rest and digest mechanism that can lower the blood pressure, slow the heart rate, and allow for a more restful and restorative sleep. The more relaxed your body is, the less the tension in your jaws, and ultimately, less grinding at night. Eat a healthy diet, cutting back on refined sugars and chewing ice, and improving your oral hygiene can prevent unnecessary stress on your teeth. The more you do now, the less you'll have to do later in terms of maintaining your beautiful smile. As we age, our teeth that seem so strong and absolute change over time and become more brittle, and ultimately more susceptible to cracks and fractures. Think of a wall with a small crack, which over time with weathering becomes larger and larger and ultimately causes the wall to collapse. Similarly, we want to prevent any added stress from grinding that could cause the microscopic fissures in our teeth to propagate into larger cracks and ultimately into something more intensive, which would require a major dental treatment like a root canal or a dental crown. So make sure to book an appointment with your dentist and stay on top of your 6-month screening and cleaning schedule. And if you do nothing else, get that night guard. In the meantime, keep smiling and namaste.